M3 mobility, 5-7. Consequences of immobility. Cardiovascular complications, rightwards arrow, decreased central and peripheral perfusion, decreased cardiac capacity, orthostatic hypotension, increased risk for thrombosis. Respiratory complications, rightwards arrow, reduced lung expansion, reduced capacity for gas exchange, pneumonia, decreased depth of respirations. Integumentary complications, rightwards arrow, sustained pressure on skin leads to decreased perfusion to tissues, risk for skin breakdown. GIGU, rightwards arrow, constipation, urinary stasis, renal calculi, infection, impaired appetite and digestion. Psychosocial, rightwards arrow, boredom, depression, grieving, anxiety, helplessness, disturbed body image. Assessment for mobility, history, PA. Medications. Ability to complete ADLs. Surgeries. Treatments. Social HX. Presence of pain with movement. Recent changes in mobility. Fatigue. Problems with balance. Recent falls.
Neuro.
Exam findings. Gait. Body posture. Joint size. Symmetry. Strength of muscles. Romberg. ROM. DX, CT, X-ray, MRI, bone density, blood work, calcium levels. Neuroassessment, interview, LOC, cranial nerves, pupils, vitals, motor function, sensory function, tone, cerebral function, speech, orientation. Modifiable obesity. Exposure to certain virus, Epstein-Barr.
Osteopenia, osteoporosis, osteoarthritis.
Chronic pain. Trauma. Pregnancy. Non-modifiable. Age. Gender. Genetics. Spinal cord injury. Result of trauma. Damage to the spinal cord can result in anything from slight weakness, rightwards arrow, complete loss of motor and sensory areas below the injury is affected. More common in men, white star. Spinal nerves, C1 C8, rightwards arrow, cervical nerves, C3 C5 control breathing, if damage point will be on event. T1-T12, rightwards arrow, thoracic nerves, responsible for diaphragm, thorax, abdomen, anything above T6 injury point is at risk for autonomic dysreflexy. L105, rightwards arrow, lumbar nerves, controls lower back, hip, legs. S1-S5, rightwards arrow, sacral nerves, control bowel and bladder. Coccygeal 1 nerve, tailbone. A complete spinal cord injury affects everything from the injury down. This means that if the diaphragm is affected, so are the intercostal and abdominal muscles. Without the use of these muscles, a person cannot breathe as easily or cough or sneeze well.
See diaphragmatic 圖片搜尋結果。
The muscles, diaphragm, intercostal, and abdominal needed for breathing and coughing may become weak after an SCI. Coughing is needed to clear the lungs of secretions and bacteria. If a person has a weak cough or cannot clear secretions from their lungs, they will be at higher risk for an infection, such as pneumonia. Qaudraplegia, tetraplegia, paralysis of upper and lower limbs and trunk, cervical injury. Paraplegia, paralysis of all or part of the tunk, legs, pelvic organs, associated with a lower injury like thoracic or lumbar. Most common causes of SCI: motor vehicle accident, violence, falls. Others: hyperextension, hyperflexion, compression, rotational injuries, transection, sports, dieases. Risk factors:
men,
engaging in risky behavior, race, ethnicity, white, older adults. The biggest thing with SPIs is preventing them. Educate on safety. Initial TX. Stabilize the spine. Prevent further damage. ABCs. Resuscitation. Preserve neural function.
four,
NG to suction. Foley. Resuscitation. CT scan, red triangle pointed up, should be obtained. Emergency manifestations: extreme pain in the neck or back, weakness, paralysis, lack of sensation, loss of bowel or bladder, impaired breathing, oddly positioned neck or back. Other manifestations depend on the level of injury. The higher the injury, the more serious the SS will be. Spinal shock. Downwards arrow BP, upwards arrow HR. Asterisk very common. Occurs immediately after injury and can last for hours or weeks. Inflammation of the spinal cord. Leads to complete loss of function below the level of injury while still inflamed. A complete spinal cord injury, complete loss of sensory and motor below the level of injury. Partial spinal cord injury may still have some nerve signals either sensory or motor below the level. Both are still as serious. Impaired mobility greater than log roll, provide assistance, teach care of assistive devices, pins, monitor for orthostatic hypotension, give an abdominal binder to keep firm, discuss tilt table with PT, etc. Give an abdominal binder to keep firm. Flaccid paralysis, low tone. Use high-top tennis shoes or splints to prevent contracture. Spastic paralysis, high tone. Prevent spasms by sudden movements. Avoid full bladders. Maybe give antispasmodics, hot or cold packs, stretching. Impaired gas exchange. Help them quad cough if needed. Impaired skin integrity. Proper skincare, turn and repo. Don't expose them to extreme sun. Avoid shearing. Proper nutrition. TED stockings. Maybe a special mattress. You should take a deep breath in, close off the back of your throat, then cough, opening the back of the throat, as the carer creates the thrust to expel the air. The sound of the cough is usually a good guide as to the force required. The cough should sound like a normal cough. Impaired skin integrity. Proper skin constipation up fluids and fiber, bowel and bladder program, digital stimulation, laxatives, best after a meal, sacral injuries tend to be incontinent. Impaired urinary, flaccid bladder at risk for skin breakdown cause they dribble. Spastic bladder at risk for kidney injury because it backflows to lower resistance. Self-catheterize, Foley's, bladder training, meds, ineffective coping. Autonomic dysreflexia, red triangle pointed up, life-threatening emergency. People with injuries above T6 are at risk for this. Causes: full bladder, fecal impaction, tight clothing, burns, pressure areas. Manifestations: BP sky high, bradycardia, HA, blurred vision, flushed face, distended neck veins, vasodilated above injury, below injury, cool, clammy, pale, no sweating nursing care for AD, sit the bed up 90, loosen restrictive clothing. Find the underlying cause, bladder. Administer anti-HDN. Call the physician. PHRM can give methylprednisone within 8 hours to help decrease inflammation and preserve neural function. Prophylactic coagulation. Meds for pain. Meds for constipation. Antibiotics for pneumonia. Muscle spasticity meds. If patient has a halo brace, make sure they are doing proper pin care to prevent infection. and apparently if one falls out you call the neurosurgeon *. Personality disorders, 4-5 borderline versus antisocial.